Hi, I'm Gregory Polk, founder of SpinalSurgeryMexico.com. We're here tonight in the city of Querétaro Airport to meet Christina Gates and her friend Gail. Gail has come for moral support. Christina is going to meet with Dr. Mario Simone, MD, FACS. She's going to have 2 artificial discs in her neck, and the video is going to be very interesting, so thank you for watching. I'm Greg Pope, founder of Spinal Surgery Mexico, and this is Dr. Mario Simone. He is here today to show us what he did with Christina Gates to help put 2 cervical discs in her neck and a cage. And now I'm going to let Dr. Simone explain exactly what he did for Christine. So, Dr. Simone, if you wouldn't mind, would you please show us exactly how you did this?
Of course, Greg. Well, it's been, tomorrow is going to be 1 week since we operated on Chris. And I think she's doing great. The first day she was complaining a little bit of kind of sort of pain, but I think it's going too well. Evolution is fantastic, the outcome. She was complaining about having a lot of neck pain, almost in the base of the neck, and also numbness of the right arm, completely numb. So after the surgery, in the first day, she told us that the numbness just go away completely. So that's a good point for us. And the second one, that she's been having a little bit of pain because of the surgery, the position, and she has to use a collar for some weeks because she had a fusion at T6, T7 level. In this picture we can see she's lying down, belly up, and we can see with letters that C2, C3, C4, C5 refers to the 2nd, 3rd, 4th, and 5th cervical vertebra. At that picture we already put pins, Casper pins, in C4 and C5 in order to spread the intervertebral space and to take out the disc at that level. The plan, the original plan, and that's what we did, it was to put a prosthesis, a disc prosthesis between C4, C5, C5, C6, and at C6, C7 we opted to put a cage with bone graft.
And
so that's what we did.
Stability of the column.
Yeah, because it is not recommended that you put 3 prostheses in a row, because lately the spinal, the spine could fail in stability. Yeah, so that's what we decided to put C3, C4, and C4, C5 prostheses, and then C6, C7, which is a level which is almost attached to the thoracic spine. It's the less mobility segment, so it won't be noticed if there a fusion at that level. And you can have also movement between C3, C4, and C4, C5, which she will not notice that it's any kind of restriction on cervical movements.
Or movement from side to side.
Yeah,
or up
yeah,
or
exactly.
down.
Now she's not allowed to move, and she has a collar because of the fusion.
Right.
If we hadn't made the fusion, only the 2 prostheses, she could be without a collar from the post-op period.
Okay. And the collar will be approximately 4 to 6 weeks, is that correct?
Yeah, I'm going to ask her to do an X-ray to see how's the column growing at that level. And at the moment I can see column forming in that level. She will take out the collar. She's allowed to take out the collar to take a shower, for example. and she can rest for a while, like having her head rest in a reposette, for example, and with support to lay down the head there and take out the collar just to relax for a while during the day. And she's also allowed to do rotation movements, because rotation movements of the head are mainly due to the union between the cranium and the first two vertebrae.
Okay.
So if someone...
But with the collar and what she had done because of the cage, there's no flexion or extension until the part she had fused is taken.
Yeah, the fusion is taking place.
Yes.
Yes.
Okay.
She's forbidden to do flexion, anterior or backwards flexion, or lateral flexion. That's forbidden. That's why she uses the collar.
For turning of the head.
Turning a little bit, it's okay. Doesn't matter. Now we're going to see the images of the final result, where you can see both prostheses in place. There is a lateral view with the prostheses in C3, C4, and C4, C5. And an AP view, a frontal view with the prostheses in C3, C4, C4, C5, and the cage. The cage is made out of PEEK, which is a polymer that it's not seen in X-rays because of the material it's made. So they put these marks, metallic marks, titanium, into the cage so you can see it in X-rays in position.
Okay, so that you know that you've put it in the right position.
Yeah, exactly.
Okay.
And to be sure where it is. This other one, it's hardly to see, but here are the marks of the cage between C6 and C7.
Okay.
And you got the two prostheses.
And tomorrow you'll be operating on Paul, that's also from Canada.
Yes.
Chris was from Canada, and Paul's from Canada, which you'll be doing his surgery tomorrow. And then in the afternoon you'll be at the retreat to see Hristine for her last day here, and to give her a final checkout to make sure that she's good for traveling.
Yeah, I think she will be. I've spoken with her every day and she's doing fine. She's happy with the results of surgery. She's happy with the outcome. And I think in 2 or 3 days she'll be able to travel to Canada, back home.
And I look forward to seeing you at the retreat.
I'm here at Casa Marino in San Miguel de Allende, Mexico. I just came to see Hristine, how she's doing, because today it's been 8 days since her surgery, cervical spine surgery. I did two prostheses at C4, C5 and C5, C6, and a cage at C6, C7. And I just came to see her, and I'm so glad that she's just great. But she's really happy after traveling to a foreign country without knowing the doctor in person or the place or anything. And now she's going back home tomorrow to Canada. And I'm very, very glad about the outcome and the results with this surgery. And I think Chris and Gail, her friend, are very happy about this visit.
Good afternoon. As you well know by now, I'm Greg Pope, founder of SpinalSurgeryMexico.com. Hristine Gates is a little bit on the shy side and asked not to do the video at the very end, but prepared a statement for me to read on her behalf. So at this time I will do so. Hristine Gates, age 44, had chronic pain and numbness in her right arm for approximately 18 months. I came to Casa Marino after cervical neck surgery and spent 5 nights in recovery. While at Casa Marino, I felt safe and comfortable in a serene, beautiful, and quiet room. The private patio with the running fountain was very relaxing. The location was perfect for my post-op recovery, as I could walk to a small park several times a day. The staff were all wonderful and attentive, and I appreciate Gregory's checking in on me daily to see how I was doing, as well to check to see if I needed anything. He also communicated with Dr. Simone addressing any of my medical concerns, as he also provided my companion, a friend Gail that came with her for support, with a walking tour orientation of San Miguel. Felisa and Adela, which are two cooks here, prepared delicious and healthy meals. Fabiola, their patient liaison, was exceptional. She gave me daily massaging showers and massaged my post-surgery sore muscles. She also took myself and my companion to a local market and assisted me with navigating steps on unlevel ground. An added bonus was the in-house movie selection and Netflix, which I enjoyed watching, as I could not move my neck to read. She had to have a collar because of the cage, not because of the two prostheses. Overall, I was very pleased with everything and the attentiveness in the beautiful and relaxing setting. Thank you for an enjoyable stay. It made my recovery easier. Now, that was very nice of Hristine to write, and I certainly appreciate her written testimonial. And I want to thank you very much for watching the video, and we will continue to have patients to come here, as it is an affordable spine surgery that we provide. Thank you for watching the video.